Ladies and gentlemen, distinguished guests, Lupus brothers and sisters, my name is Kirsi Myllys. I'm from Lupus Finland, and it's my pleasure to welcome you to the Lupus Europe Convention, Helsinki Convention, the 25th Lupus Europe Convention. Back in 1997, Lupus Europe was called ELEF, and that was the last time we were in Helsinki. I saw the people on the boat to Stockholm. I don't know if they ever came back. Okay, they did. Let me introduce the speakers here now. The next one is Kirsten Lerström from Lupus Europe. Then after her is Maria Ekrot from the Finnish Rheumatism Association. And then Jaana Huhta from SDM in Finnish, the Ministry of Social Affairs and Health. Thank you all who made this possible. Thank you Rheumatism Association, and especially Jaana Hirvonen, who is not here today. We worked closely together from day one, about a year ago. I thank her for her stimulating support and all the salmiakki we shared. Thank you, the whole board of Lupus Finland. All of you have worked for this convention and helped me on the way, encouraged me, and especially Päivi Vaarakallio. Where is she? Hand up. Oh, she's outside. Päivi Vaarakallio is guilty for making the convention poster. It's marvelous, isn't it? And she has been updating our website, our Facebook page, everything. And her husband is the one with the camera. Thank you, Joppe. The convention poster over there, that's by Päivi Vaarakallio. Finally, I want to thank Glasgow and Finnish Rheumatism Association for sponsoring this convention. And Sobi, as part of, and UCB, and who else? I declare the Lupus Europe Helsinki Convention open.
Thank you all for coming this morning, and thank you for helping us celebrate our 25th anniversary of celebrating the convention, the annual meetings of the European Lupus Groups. We are very happy to see you all here today, but also we do remember both the ones who are not here for one reason or another, but certainly also the reason why we are here, because lupus is the most unjust, strange, complex, complicated disease to deal with, especially for the ones living with it. The convention is for member organizations. First of all, to share ideas and experiences, but it is also to learn about the new advancements, research, health, care, social issues, and how it is to live with lupus. And it is, thirdly, also the network that we create, meeting together, that keeps us in contact in between the next conventions. Hopefully, we hope very much that this is also something that will help boost you in your hosting country for creating a stronger and a more heard lupus group. A year ago, we met in Paris and had a wonderful convention. For the first time, we also did an evaluation. What is the convention? What is it? What do you, the delegates, think about being at it? And we had a fine evaluation. It was generally okay. We also heard that you would like to have more interaction. So this is what you will see in the program for the next days. Finally, we hope very much, at this moment in Stockholm, the Scandinavian Rheumatism Congress is taking place. This is where the specialists of the so-called Scandinavian Council of Rheumatism joins the meetings. They have now done this. They have all represented very old organizations for rheumatism all over the Nordic countries. Very strong tradition. But if we had planned it better, we would have done it together with them, of course. We didn't know, but we now know that the doctors will remember us perhaps next time. In the Nordic countries, besides having these strong and old working relations, they also have perhaps some of the older lupus groups. Speaker was mentioning that already in 1997, the last time it was that they hosted the convention. In 2007, we were in Bergen in Norway, and in 2011, we were in Copenhagen. So, perhaps soon we could be in Sweden. We don't know. We hope so. But after all, we have a long program ahead of us. Thank you all for coming, and I hope you will enjoy. For the program today, we have the official welcome. I use this one. Okay? Yeah. We will have the keynote on access in the afternoon. Then tomorrow we will have the council meeting. We will have a special session on treatment. We will have a special session Monday morning on patient partners and research. That day follows with a crash course in social media. We have the crash course engagements on volunteers. And we will have the session of knowledge and empowerment. Treatment, knowledge, and empowerment are all the subtitles for the general theme, A Better Life with Lupus. So, I will leave it at that. But you will come and introduce?
Our next speaker is Maria Ekro from the Finnish Rheumatism Association. Please give her a welcoming hand. Okay, thank you. And nice to meet you all here. I want to also, from my behalf, warmly welcome you all to Helsinki, Finland. The sun was shining, so I think it looks as the best in autumn time in Finland. It's not always so beautiful, but I hope you enjoy and have a nice weekend here. So, a couple of words why it's so important to have this kind of convention. As we see, single people with lupus, they are quite alone. or single association alone, they don't have so much strength. But what we do, we all associations, we start to build networks. We find those people uh, and connect them, and then as here, we have connect associations from different countries. So which makes us so much stronger than anyone alone. Together, when we have the same direction, we know what we want to do, we have so much more power. And no one needs to feel that I'm alone. Everybody can see that there are also other people who understand me better than any other. In those associations, when we all want to do same work, we have a good feeling, we can support each other, and we really can do the difference. And what connects us is that we all love what we are doing. We want to help other people. We want to feel good that we can support each other, and we can help people to support themselves. And with a pure heart, when we really, feel what we do, it's kind of honest work, and then people trust us. They wanna join. So, what are our tasks? We have to spreading the information. People have to know more about lupus, and those who get this disease, they have to find us to be able to join. So we have to support, help, assistance, guidance, as we have a lot of information in internet pages. We have a brochures. We speak with the healthcare people, doctors. So we kind of make all this information possible for people with disease. And we also put them together, and we also support all the associations so they can work. And we are not only helping, we are just between there, and people can help each other. So let's pay forward. I love this picture because it's what we do. We do and we want to help, so other people do the same. And in the end, there are a lot of people who are working for lupus. So we really are much stronger. And we all are needed for growth. We all are needed to spread this information. But that's always in associations. We have to be very creative. We need brainstorming, and this kind of convention is perfect place for that. You can share your ideas. You have a lot of experience in your countries. Maybe some of you have made really good projects. You can give that information for the others. So not everybody has to start from scratch. So altogether, I'm sure that when you leave from here, a lot of you have more power, you have more knowledge, and then you can go to your own countries and create a nice thing. And this is one very good example. How many of you have heard about this Ice Bucket Challenge? Yeah. So I think this is brilliant because actually they didn't need money, they didn't need any special things. It's just a brilliant idea, and the heart, as I told, the heart always has to be there. So when the guy who did this first film had a heart and wanted to spread the word, without a big budget, without a big plan, it has touched people, and people start to spread it all over in the world. And at the same time, they had a lot of money because people want to support the charity. So I think we should find our own Ice Bucket Challenge one day, think what could be that kind of thing. And that's why the creation is very important. Find a way to touch people without or people who like to support them and your associations. Because the world is full of new ideas and possibilities, and we have great things in the future. And I'm sure after this convention, when you go home, you have many, many good new ideas. So we just have to try new things and open our eyes. Maybe we can go out of the box and make something really different, as they did with this Ice Bucket Challenge. And have to care about the people in our association, because when people feel good, the group feels good. And it's important to remember that we have to enjoy what we are doing, because especially in Finland, I don't know if it's same in your countries, but in Finland, people doesn't always say if you have touched them. They don't always remember to tell that. So even if you don't always hear thank you, remember that your work is very important. I have one good example of my life. When I was in high school, my math teacher came and said that, I'm sorry, but I have to give you 8. We have a grade from 4 to 10. And actually, I know that you're really brilliant in math, but you've been a little bit lazy, so I have to give you 8, even I know that you could be worth of 10. And it was only that one sentence. What happened after high school? I read again this, and made a new exam. I got that 10. And all my life, I love math after that. I always think that math is nice. I think that, okay, I'm quite good at it. But do you think that my teacher knows how important that one sentence was? No, because I didn't understand it that moment, and I never told her. But later on, I have now started to search if she's still alive and where she is. I really would like to thank her and tell that it was so important. And I think we make a lot of miracles in our association. We give the meaning of the life for many people with lupus, but maybe we never know it. So that's why we have to know that we are important. The work we are doing is very important, even if we don't always hear that. And that's why we have to support each other in the association and remind that it's good things what we do. So I just wish you very giving convention. I hope you have a great time in Finland and you have the strength and good spirit when you go back home, and we all can really be strong together. Thank you. Okay, I won't let, are you hearing me? Yes? Yes. I won't let Maria leave just yet. We want to thank her. Just a second. I forgot to tell everyone that Lupus Finland is a member organization of Finnish Rheumatism Association. We're a rare group. There are only 1,500 lupus people in Finland, and we're a national group. And most organizations under the umbrella of Finnish Rheumatism Association are local groups, and that makes it problematic sometimes. Yeah. What else can you say?
What else can you say?
Well, can you say something about the weather? It's a nice autumn in the beach. Soon we will have this ruska, so we will have a nice colors in all the trees. But
I think it would be nice if you would teach us how to say that in Finnish.
ruska.
No.
Thank you. Kiitos.
Everyone, please say kiitos.
Kiitos.
It's good to know when you are.
Any other questions?
Any other questions? We seem to have time. Okay. I can tell something about the Finnish Rheumatism Association. Why this topic was so important for me is that we are making big brand renewing, because many associations have to, kind of renew themselves, and so that's why we are thinking a lot about the spirit, how to get people excited about what we are doing, thinking things in a new way, and make everything look different and new and interesting. We have a very long and great history. But anyway, most of our members are quite old, so they I don't mean in that way, but it's declining, so we have a less and less members, and that's why we have to renew the organization in a way that we can talk to more young people and also people in the working life, so we can have a better future together, and that's why we have to work a lot with the spirit. Thank you. Okay, I'm not leaving you just yet. It looks like the time is coming closer. What about, have you been mushroom picking? Actually, no. Yeah. Don't you like mushrooms? I love mushrooms. Me too. I don't know so well the forest, and I'm always so busy, so I don't really have time to go there. I've heard that this is a very, very good mushroom year. Yeah, I have heard the same. Yeah.
I'd like to know some ideas about our own ice bucket challenge.
Yeah.
Do you have ideas?
Ideas for that.
In the UK, we're doing sunglasses because we're all photosensitive. So we're posting pictures wearing sunglasses, nominating 3 other people and asking them to put up their photo and make a donation as well.
Oh, perfect.
Nice.
That's what I meant, that you can borrow good ideas from other countries, but soon you will have the same thing in the whole Europe.
And do you have any ideas in your group? Have you had any ideas in your group?
No, not yet. No, we have an idea. Yeah, different kind of thing, but not like an ice bucket challenge. Yeah, we are thinking something for next spring for that one. Of course, we have a lot of different kind of activities. We have a working day. We have a lot of support meetings. We have lectures. We have a different kind of courses and a lot of program all the time.
And here, because we still seem to have time, Lupus Finland, as I said, is a national group. So we desperately need a rheumatism association or the other rheumatism societies around Finland, because they arrange peer support groups. And all we can do as Lupus Finland, the national group, is to provide online peer support possibilities. But there is no way we can arrange that everywhere around this huge country.
Yeah, we have 150 associations all over in Finland, and so that's why we are coordinating and helping them. So, and they all are volunteers. So we have 43,000 volunteers in Finland who are working for rheumatism.
And since we still have time, I'm going to take you on the history part. Lupus Finland was founded in 2001 by us, lupus people with lupus. So, we were told, it was a suggestion by Jana Hirvonen from the Rheumatism Association, that you only need 3 people to found a society. And we took it on. We started it. And there was, at the time, 2 groups. One group was heavily organized underneath, inside the Rheumatism Association. But they in fact wanted us to go and be on our own and register our society, which we have done. So we can even employ people if we have the money. So we are a perfectly official entity, Lupus Finland. And Lupus Finland's address is, by the way, Lupus Street, Susitie. Okay? Did you know that? Oh, we still have time. Yes?
So people in Finland know about lupus. It is treatment that people know about, even if they have lupus.
No, they don't. Yes, and not the doctors either. So we have to know a lot about our own illness to demand for doctors to find out beforehand, before we meet them, preferably. Okay. Will you present?
Like so many, we're always a little bit late because sometimes it's hard to get going in the morning. But thank you so much for your participation. It was very inspirational for me, and I think for the others too. Beautiful presentation. Thank you very much. And this has been part of If you have your seat, and you come back anytime, you can stay and have dinner and dance with us tonight.
Our next speaker, please give a welcoming hand to Jana Huta from the Ministry of Social Affairs and Health. I'm just putting this up.
Okay, thank you, and good morning, all of you. On behalf of the Ministry of Social Affairs and Health, and especially on behalf of myself, I have a pleasure to welcome you here to this meeting. The Board of Lupus Europe, all representatives of the national NGOs, and other participants here, members of Lupus Finland, maybe their other members if you're here, and everybody else, also the experts who are coming here this day. It's very nice, it's very inspiring that you have this meeting here in Finland, and you have many important tasks to do, to think, to discuss, as we already have heard from this previous presentations. Okay, I have it. Let's try it. And I also hope that these following days will give you inspiration, strength, empowerment, and new ideas of the work, but that you also have time to enjoy of the beautiful Helsinki and the surroundings maybe. And I think at least today the weather will be nice, and you will be spending it here inside. That's a pity, but hopefully it's not so bad the coming days. I myself have also quite good connection to the Lupus Association work. It goes back in my own history with Lupus goes back in the late 70s, and I was quite active in 80s and 90s in this work with the Finnish, in that group, which that time was beginning its work and was working in the umbrella of the Finnish rheumatism organizations. And I also have had the pleasure to be involved with the LF work. So 25 years ago, actually 26 years ago, there was a meeting in London where there was the first thought down to have this organization, and after that I had the pleasure to take part quite a few nice meetings around Europe. I think there maybe aren't any of those persons here today, or there is. Okay, hello. So we'll have a chat later on. But I remember many nice and inspiring moments with them.
I think there are more. There's one and there's complaint.
Okay, well, we'll see. There I remember very Brian, Rudy, Luke, many others which were very active at that time. So, but now I was asked to give a little speech also on the behalf of my civil work. I will give you some brief looks to what is happening in the field of social wealth and health care in Finland. Only a very brief. I don't have slides because I think you have enough of these days, and I also have enough with them to do at my work. So I now give you only a brief look. But if you're interested in this, then I can handle to teach you some material later. Some points of what I'm doing at the Ministry of Social Affairs and Health. I've been working there now nearly 7 years, and I work there as Minister Advisor in the Department of Social and Health Services, and especially for social services. But of course, we have very common and very tight work together with health services, and also the things which go to the rights and position of the patient and of the client in social services. So because it always goes together, it's not only the health, it's not only the care, it's always the how you manage the everyday life, and that makes the good life for all of us, and that makes a good life for persons with lupus too. Our system of social services and social care, social welfare and health services is under a big change these days. It has been it for many years already. We have been trying to make a very big structural renewal, and as nowadays there are many, it's almost the main responsibility for arranging the services, of arranging the care goes to local authorities, to municipalities, which we still have quite many in Finland, and they are responsible for organizing the social welfare and health services. They have very strong degree of autonomy in arranging that, and our national supervising and national guidance is always, it is said that it is always strong enough. Our services here in Finland are funded by the municipal tax system, and also quite great allocation from central government. And municipalities can also purchase services from private service providers. Now, as I said, we have many undergoing reforms. Also, already 2 governments actually have tried to do this so-called structural social and health service structural reform. And last summer, actually, we got the big decisions. We tried to open the knot what we had, and now we are preparing the legislation for the Parliament this autumn, and we hope to get this very, very important new legislation in a couple of years to come. We also, beside of this structural renewal, which of course only goes to the structures, how to arrange, how to pursue, we have a very great big substance legislation we changed. We have had the new Healthcare Act of Healthcare a few years now, and one point in it is to strengthen the choice of freedom of choice for patients. And also now when we are reforming our social services legislation, and also the legislation concerning the services for persons with disabilities, it is very important to have the view in the client, in the person who is using services, who is needing them, to take very much account what is the functional capacity and range of services which the services are aimed for. And now some key objects of, I'll look at the clock. Some key objects of this big reform we are now having. Of course, the fundamental object is the promotion of health, well-being and social safety of the all population, and to guarantee equal provision of social welfare and health care services in all parts of the country. As I told, as we have many municipalities, we still have, I think, more than 200, I don't actually now know that, but yet we had we had nearly 400 and now we have, I think, it's in the middle of 200 and 300 now. And of course, the wish of the government is that there will be less municipalities and they will be bigger, and this renewal will really make them to do this job now. It's also, the object is to strengthen primary level services, also both in healthcare and also in social services, because we have very divided system, especially in health services. We have this primary level and then the upper level, and they don't always come so get together, as you probably know when being a patient also in other countries. And of course, one key object of always we have to admit it is that we should deliver cost-effective, high-impact service structure. That is one thing. And now, as I said, now it's in the local cases, and then we have, of course, some bigger units above it. The future will be so that the responsibility for arranging the services will rest only on 5 social welfare and healthcare regions. Also only on 5 regions in Finland, and under them are then the municipalities or the joint municipalities of those actors who will actually arrange and provision the services. And this new concept is or will be totally different from the current model, and that you can guess is has caused very much discussion, and it's going on just now when the legislation suggestions are in the country, and the persons and the municipalities can say, they can give their opinions on it, and after that then in ministry the civil servants will make the law ready for the parliament to decide. And what is important also when we think about the services of persons, for example with lupus, the persons who need both services as healthcare and social services. So it's very important that they can get them as a whole, that they can get them from the one place as much as possible, and then there is information of the situation and needs of a person in one place. You don't have to run different places to get to there every time. Once again, what is the problem, and so on. So that is a very big change that is coming. But when we think it to the person, to one individual, it should also be very important for him or her in his or her private situation. So this new welfare and healthcare region will be responsible for ensuring that the residents of municipalities in the region and other entitled to use the services really receive the services they need. That is very big responsibility that's given to these regions in the future. So we aim to get the widest possible integration, and people's needs for services will be addressed as a whole. So when I think this big picture and how to connect it to the, for example, to the lives of persons with lupus, there is certainly a possibility, and I hope it will come true, to make it also possible to give better care and better social services to ensure the better life also with persons with lupus. And if I still have some moments, I'll give us a little brief what is in Finland, what we have done also in the area of rare diseases. I think many of you know in the European level this European recommendation for care and services of persons with rare diseases, and in Finland we also took the task, took this up, which was given from this European recommendation, and we have last spring it was finalized the Finland's national plan for the rare diseases, and now actually last summer there was we had a steering group to draft. Then after that, national plan, a detailed plan for action. So that is, I don't know whether you have been in Finland. Yeah, I know that Jaana Hirvonen was in the steering that group to do this plan, and it's very important you're with it, because now I think now it's also when think what I just said about this new reform in social services and healthcare. It's now the thing, now the time to do something for example, to get those centers of expertise and the place for these rare diseases also in the big picture is now possible to get. So in this Finland's national plan for rare diseases, there was very many. There were representatives for patients' organizations also with, and it was very important that it is so, because as you all know very well, you should always be working there where happens. You should be involved what is concerning yourself. So in that work, there were, of course, it recognized need for special measures. It recognized what was needs in the to do with the legislation, and the outcome was that rare diseases call for special measures to ensure equity to access to quality care and rehabilitation and social services. This both should be remembered. And in this national plan, there are 13 suggestions to action, and now when I mentioned that now there is this steering group, so it will detailing try to work these to go further. And these suggestions, they deal with equal quality of services compared to other persons. They call for expertise, they call for centers of expertise, for knowledge, information, awareness raising, all the things you know very well in your work and in this area with lupus, that they are mostly needed. And also there are suggestions about cooperation between different actors, social health, employment, education, because there's always should be remembered that your life with some rare disease, your life with disability, it's not living with that all the time. It's only the part of your life, and it should be it's probably should be in the side of it, and you should live a full life despite all that. So it's very important in this work that also national NGOs are very, and persons with living with these issues are very much with. And so now I think in this point of view, as I've given you a brief look what is happening in this administrative and also in political level, of course we're now getting elections next spring, and it's very important also get these things with our new common program and everything like that. But I think I myself truly believe that there are things that give possibilities also to make improvements in this area, and I certainly hope that it will be so. And I think in your work you should take account of this also. And then I also in the end I come back where I started. I mentioned about something about myself. I hope this also gives strength and empowerment for all of you to go ahead. I was 19 when I got my diagnosis. I just had made my matricular examination, and then I had some quite hard years in the beginning of 80s and with this disease. And that was the first time also I think it had gone a couple of years. I wasn't living in Helsinki at that time, and before I even met or even heard of somebody else who had this disease. That was in the beginning of the 80s. I think I by constantly heard about this kind of an official group. I met Senika Jussilainen and then also Marita Vanhanen and later Kirsi and Marietta Sykke, who is not here, and many others, and get into that work. And really, my eyes opened as I learned from locals, and I learned from people who were living it with it. And it was a very great experience. I believe it's the same for everyone who is involved in this work. So, as I said, I had quite, and at that time I also had the opportunity to read Dr. Prem Hughes in London, and now I become very touched when I think about that, because and he was the one who gave me a belief that I could have children, and I have 2 daughters. I don't know what is going on with his life today. I hope he's well, and if there's someone who knows him, so give him my
Can you
regards.
say how he's doing?
He's very well. He's in France at the moment.
Okay, yeah. I read him because he's so inspiring and lovely person. But give him my regards if you happen to meet him. So I have to. Then after that, I got. There was a remission, and it has been a remission with my lupus, a kind of remission, I should say. I ended my studies after very serious symptoms I had. Before I made my law degree in the end of 80s, and as I thought, I have 2 daughters, which are 20 and 25. I had very bad carpet necrosis in my both hips, and it was very hard few years. But 5 years ago, I had my hip replacement, and it has been a new life after that. Everything went well. So then I got by coincidence work in the disability field. I was working quite many years in the NGO, and now I'm in the ministry, and I'm trying to give something of this my own experience to the work when I'm reviewing, for example, the legislation concerning the disability services in Finland. Lupus is always part of me, but it's not ruling my life. We come along quite well nowadays. So now there are new reports almost coming. I really hope that you have a nice and successful days here. And then I actually end by that same wish that the AIM and the Lips Europe has in its web pages, that the work is that persons with lupus can live independent life and be recognized in equal members and in society. Thank you, and have a nice day. Jana, I have to say thank you very, very much. You have the ear of the Health and Social Minister of Finland, and you have lupus, and you have had a story like so many of us. Thank you extremely much for what you were telling. This is so important, and it's also important to know. We have quite a few of the young ones here, even just arriving today. Yeah, thank you. Thank you, Jana. All right. If I just may follow up on what she was saying, on the European level, we have some new commissioners coming into the European Commission, and the NGOs came together, who has raised, or several NGOs, who have listed 10 crucial demands for the new health commissioner. And they will, as soon as he is appointed and they have that panel meeting, and I think it's shortly, in a week or two, they will ask him. And what they will ask him is also what Jana was telling about: access, respect, involvement, and definitely also the chance to have us patients represented on the side. So because people like you and her, we're getting there. It makes a huge difference to be involved. I think I will talk just a few minutes more, I can see. Any of you, may I ask, have any comments? Did her presentation, her story? Yeah, Tor?
I think the great idea of getting into better regions instead of small devices has been done like almost in the same way in Denmark for a few years ago. And that has made, in Denmark at least, the opportunities for people with lupus to get better in touch with the big university hospitals. So I hope there's the same progress of having here in Finland, because that was one of the best steps done for many years for us.
Yeah, what actually happened was that they made a new plan of how to divide the specialties, the medical specialties.
Like regionen.
Yeah, yeah. But who will do what? And then for lupus, it was also said, if you have this kind of lupus, you can go these places. So we had the opportunity to tell our members if they were not already in a place where they had a chance to go to somebody, with the capacity to deal with lupus, that they could go there with this new plan in hand.
So, okay, I have just one pedaling, okay?
Okay, next, we have a group of 12